A production fee has been paid to WBBZ-TV by Buffalo Healthy Living and its sponsors. Children's vaccines. What is the new childhood vaccine schedule? How will it affect us all? Why are experienced pediatricians and global health organizations warning that the new schedule might be unsafe? The U.S. childhood vaccine schedule has gradually expanded over the decades, but a major overhaul by the Trump administration in 2026 drastically reduced the number of recommended vaccines from 17 to 11. Scientists and doctors are pushing back because they feel that having followed a unified schedule since 1995 based on evidence, that the sudden change is not based on scientific research. In fact, it defies the research. Before the January update, the U.S. childhood vaccine schedule evolved gradually, adding vaccines such as HIV in the 1990s, chickenpox in 1996, rotavirus in 2006, HPV in 2006 also, along with periodic updates. Dr. Tom Frieden, president and CEO of Resolve to Save Lives, a former CDC commissioner and former New York City Health Commissioner, recently discussed the changes with the U.S. Department of Health and Human Services, warning about the harm that they are likely to cause, saying that they represent a step backward for health in the United States, particularly for children. Now, on this special edition of your Hometown Health Connection, we're going to meet Dr. Stephen Turkovich, president of Golisano Children's Hospital, who shares these concerns. I'm John Di Sciullo. Welcome to your Hometown Health Connection. Let's meet our guest, Dr. Stephen Turkovich, president of Golisano Children's Hospital of Buffalo. Dr. Turkovich is a board-certified pediatrician and president of Golisano Children's Hospital of Buffalo, formerly John R. Oshai Children's Hospital and Women and Children's Hospital, if you go back that far. Dr. Turkovich manages daily hospital operations, including clinical, ancillary, and support services, community physician relations, and off-site pediatric and obstetric primary clinics. He also ensures compliance with regulatory requirements to maintain the pediatric level of 1 trauma program, the Regional Perinatal Center of Western New York, and the Level 4 Neonatal Intensive Care Unit. Dr. Turkovich has more than 20 years of experience in pediatric medicine and leadership within the hospital system. A graduate of the UB Jacobs School of Medicine and Biomedical Sciences, he completed his pediatric residency at the University of Rochester Medical Center. As the leader of our children's hospital, he focuses on advancing pediatric care, supporting clinical teams, and fostering partnerships to improve health outcomes for children and families in the community. Dr. Turkovich has won numerous awards and honors as a fellow of the American Academy of Pediatrics and a member of the Alpha Omega Alpha Honor Medical Society. A Western New York native, Dr. Turkovich lives in Buffalo with his husband and 2 sons. Doc, for such a young guy, you have so many great credits. It's great to have you on board again.
Well, thank you. It's my pleasure to be here. Thanks for inviting me.
You're welcome. We have a lot to cover, and Annette Pinder from Buffalo Healthy Living magazine has done so much great research. We want to share your insights on the importance of childhood vaccination, both from your role in the community and as a member of the American Academy of Pediatrics, and of course, as a parent of 2 children. So let's start. Dr. Turkovich, we are being told that changes to vaccine schedules have been made to align more closely with Denmark's childhood vaccine schedule. Now, is this because Denmark is more similar to the United States, making it important to follow their lead? And if not, can you explain why adopting Denmark's vaccine schedule might be potentially problematic?
Well, it's extremely problematic. And as you can imagine, Denmark is extremely different than the United States. So just from a population perspective, we're over 330 million people here. They are 6 million, which is smaller than the size of Atlanta. From a geographic perspective, they are about the size of West Virginia. And so each country needs to look at what their disease risk is, as well as what the infrastructure is around healthcare. And so in countries like Denmark, where you've got universal healthcare and you have access to testing and diagnosis really easily because there's no barriers from an economic perspective, that's part of the calculation in terms of what vaccines you should have. As you all know, we unfortunately don't have universal healthcare in this country. So accessing healthcare is not easy for everybody, and we've got significant disparities. The other thing is cost. Sometimes countries, and I don't know what's happened in Denmark, but sometimes countries will choose not to provide a vaccine universally because of the cost, not because it's not safe or not because it's not effective. So you really can't cut and paste public health policy from one country to another. The policies for our children are based upon what's happening here in our country. And really, we should not be using any other country like Denmark or others to decide what's best for the children here in the United States.
So what do the new requirements say? Which vaccines are being recommended and which are being eliminated? The recommended changes are they based on clinical studies? And has science changed over the past several years, making these changes important or even necessary?
Unfortunately, these changes were completely arbitrary. There's no evidence behind them. So what should happen and what has happened prior to this administration is that there's a very deliberate process where vaccines go through multiple studies from a safety and effectiveness perspective. Those studies then get submitted to journals and they're reviewed by outside peers to make sure that they were done well and they're appropriate and they're true. Then those come together, those studies, and go to the CDC, and there's an independent review panel that will look at all the studies and again, independently look at them and make some recommendations based upon the science and the evidence for what would be best for the children in our nation. And then those recommendations go up to the CDC. And that's the process that we've used for decades. Each time we've sort of modified. Sometimes we've added some vaccines. Sometimes we've changed the timing of vaccines. And it's always been done based upon science and evidence. These changes are not based on any of that. They have just been arbitrary. The independent council did not review them. There's no studies that go to support these changes. So at the end of the day, what we are recommending is you continue on with the prior schedule. The American Academy of Pediatrics, the New York State Department of Health, all support the prior schedule and do not support any of these changes.
So I guess to follow up, multiple leading health and medical organizations have formally challenged or sued the federal government's new vaccine recommendations. So they sort of argue that they were adopted without proper scientific review and, as you mentioned, maybe possibly putting children at risk. And you mentioned those organizations, the American Academy of Pediatrics and the American College of Physicians. So are parents still allowed to adhere to those long-standing evidence-based vaccines? They can do what they would normally want to do for their children in best practice, right?
Well, you should always, as a physician, have conversations with family members about every vaccine, the risks and the benefits, so they understand, what the disease is that we're trying to prevent, what the risks of that disease are, and what are the side effects of the vaccine. And then parents make those choices based upon that. The regulations are really when it comes to going to schools. And each state, including New York State, puts together what vaccines are required when you go to different grades in schools. That is not changing in New York State. So, at the end of the day, what has happened here is these changes have caused some uncertainty. They've caused people to sort of question the evidence and question the science completely unnecessarily. And it creates doubt and it creates confusion within parents. We had a very clear schedule that was laid out. Everybody at certain ages were recommended to get different vaccines. And now they've created these different tiers of everybody should get this bucket. And in this bucket, maybe only people that are high risk. And in this other bucket, you should talk to your doctor about it and make a decision, not sure sort of thing. So when you add those complexities to it, again, not based on any science or any sort of evidence, it just causes significant confusion. And at the end of the day, parents, well-intended, are probably going to be making some bad decisions that are ultimately going to harm their child because of the mixed messages that they're receiving from the CDC.
Wow, a lot to sort through, and as a doctor and your team, a lot to go through. The new guidelines say that if parents want to include the 6 vaccines eliminated from the schedule, they should come to a decision about that based on a discussion, as you mentioned, with their child's pediatrician. However, if there's no valid scientific evidence to support that challenge, how can pediatricians and parents make that decision? Is this a shared conversation between the doctors and the parents? Because they must be coming to you with their questions based on what they're hearing.
Yeah, they are. They're asking questions, and we welcome that. We should be having these dialogues with parents so they understand everything that we're recommending and why. When you go back and you look at some of the very specific ones, I think hepatitis B has been one of those that's been in the news quite a bit. And the big change with that is, number one, it's moved away from universal, but they also changed the timing of it. And they changed the timing of it from a birth dose, which prior to this, we were recommending, and we still do, that every baby gets it within 12 hours of birth. The reason is, prior to 1991, we actually used to do this sort of shared decision-making, high risk only, where we only gave it to some babies. And because of our lack of really true universal health care, there were moms who had hepatitis B, who had no symptoms, did not know they had hepatitis B, and unfortunately then passed it along to their baby. And hepatitis B is a very bad virus that can cause chronic liver disease, sometimes liver failure and liver cancer. and ultimately cause somebody to pass away from that. And so obviously we want to prevent it. So in 1991, we were seeing hundreds of thousands of different cases of hepatitis B. And so the decision back then was to make this a universal dose. Everybody gets this at birth. We have decreased the number of hepatitis B cases in this country by 99% since 1991.
Wow.
So the history has proven that these vaccines, this timing and this duration of them are all evidence-based, and the evidence since 1991 continues to have proven that. I can also talk about my own career. So when I started as a pediatrician, rotavirus, which is a terrible GI virus, which causes severe vomiting, diarrhea, and ultimately dehydration, especially in babies, was something we would see every year. We would have rotavirus season where babies were admitted and fill up the hospitals and IV fluids, really in miserable state because of how they feel. And we've all had the stomach bug, and it never feels good. I would say since the vaccine has happened, I can maybe count on one hand the number of cases I've seen of rotavirus over the last several years. So it really does work. It's almost been completely eliminated. And the newest one, which I think is the biggest impact, is RSV. So as we always talk about every year, RSV is a terrible virus that affects everybody, but disproportionately has really severe effects on babies and makes it really difficult for them to breathe. It's the youngest amongst us, and sometimes the most premature are the ones that are the most affected. And if anybody has ever had a child who's had difficulty breathing, it's one of the most awful things to watch. And so every year in every pediatric hospital across the nation, hundreds of children would be admitted, babies mostly, here, put on oxygen, sometimes put on ventilators to help them breathe for several days, to help them get through this. Sometimes also in young babies, it can cause apnea, which causes them to just stop breathing, which is very, very scary. The new vaccines that we have available have decreased the number of hospitalizations by 80 to 90%. And we're actually seeing that this year right here in Buffalo, that the number of children that are admitted with RSV is down about 80% when you look to where we were 2 to 3 years ago before the vaccine. So in real life, in real time, right here in Buffalo, we are seeing the evidence of how great these vaccines are to prevent severe disease and illness and hospitalization. At the end of the day, we said these changes were not made on evidence. These changes are actually contrary to what we're seeing. They're the opposite of what we need to be doing.
I remember the RSV being in the news cycle so much in the last couple of years. We're talking to Dr. Stephen Turkovich, president of Golisano Children's Hospital, about all of the changes surrounding childhood vaccines. And let's do a quick review of each of the vaccines, some of which you mentioned that have been removed from the recommended schedule from what we understand. The rotavirus vaccine, which you mentioned, protects infants against severe diarrhea and dehydration. The COVID-19 vaccine, previously recommended for children at certain ages. The influenza, the flu vaccine, hepatitis A, which immunizes against hepatitis A, and the hepatitis B vaccine, which you just identified, and the complexities of that. The meningococcal vaccines that protect against meningitis. So what are your thoughts on the removal of it based on what those recommendations are? And is there some way that anybody can lobby to get them put back?
Well, so there's good news, bad news here. The good news is in New York State and the New York State Department of Health, we have not made those changes. So your pediatricians here, and I'm sure across the country, will continue to follow the old guidelines. But the danger here is that people are going to see that these vaccines have been quote unquote removed, and they're going to choose not to get their child vaccinated. And I will say, and any sort of child who passes away from a preventable illness is just devastating. And in my career, unfortunately, I've taken care of children who have died of the flu. And the children that I have cared for who've died of the flu had no comorbidities. They were previously healthy. And when you look at last year's flu season, over 280 children died of the flu. When you look at that, almost half of them had no underlying conditions, perfectly healthy, no asthma, no diabetes, nothing that would have increased the risk of having an adverse event associated with the flu. When you look at vaccines, out of those kids who did die of the flu, almost 90% of them were not fully vaccinated. So it's one of the easiest, simplest ways to protect your child from the flu. And that then extends all of these. Meningitis is a terrible disease that even if you survive, oftentimes you'll have permanent neurologic damage, brain damage from that. And it's got a very high mortality rate. So each one of these vaccines will protect you from long-term effects or, unfortunately, even a mortality or dying from that illness. So at the end of the day, what they have done is in my mind, irresponsible and causing unnecessary confusion and unnecessary mistrust.
I can't imagine losing a child at all on any level, let alone if you haven't taken the proper medical precautions. You and your team just do such a great job. Vaccines let's talk about what are currently recommended. They include diphtheria, tetanus, pertussis, which protects against whooping cough, tetanus, diphtheria, measles, mumps, the MMR virus. Combined vaccine against measles, mumps, and rubella, the IPV. The HIB, which is Haemophilus, am I saying that correctly, doctor?
Yep, Haemophilus influenza, which also can cause meningitis.
And the pneumococcal conjugate vaccine, PCV, the chickenpox, I go back to that in my youth, the human papillomavirus, HPV, but some of these timelines have changed. And is this going to continue to be a problem? And why are those vaccines recommended, but the others are not?
That's a very good question about why these were recommended or not. And I think at the end of the day, by separating these vaccines into these different categories, even those that are recommended and have not, quote unquote, changed, there's still this confusion around it. And I think the biggest evidence of that is what we're seeing across the country with measles. So the MMR vaccine, measles, mumps, and rubella, has not changed anywhere in terms of being recommended. But we're seeing less and less people choosing to get that vaccine. And that's why we have now a current outbreak in South Carolina. And we are very likely going to lose our status as eliminating measles in this country because of the number of measles cases that we've seen across the country this year. And so, again, what they've done is they've just caused significant confusion. And we're seeing, unfortunately, the effects of this. And measles is the perfect example.
Well, not only confusion, but are then parents becoming afraid to vaccinate their children, no matter what their age, whether they're infants or, as age progresses?
They're afraid, and they're also waiting. And they're waiting, and they're trying to extend things out and delay things. And, sometimes virus and diseases, they don't wait. And so the timelines that we have in our American Academy of Pediatrics now in the Department of Health schedule were studied. So we know exactly the right time to give these vaccines. It's tied to when they're most likely to get diseases, but it's also tied to when their immune system is ready to accept and have the most robust immune response that will protect them the most. So when you deviate from that schedule, potentially you're going to make the vaccines less effective. The HPV vaccine, you also mentioned that, human papillomavirus. So that's another really significant vaccine that protects people against a virus that causes cancer. It is a way to prevent cancer. Many times people think about cervical cancer, but it also is a very big cause of head and neck cancers. And so at the end of the day, if we vaccinate somebody after they've been exposed to this virus, it doesn't work. It's already there and it's not going to kill the virus. So you really need to do it as quickly and early as possible before people are exposed to that in order to prevent them from getting these cancers caused by HPV later in life.
You've talked about all of the benefits of vaccination, and there's so many statistics. But what are you seeing here in Buffalo right now? What is the need medically for the children from what you're seeing at Golisano Children's Hospital?
Fortunately, we haven't seen any cases of measles here. We are actually seeing the benefits of the RSV vaccine and seeing less children being admitted with RSV. So that's good. We are seeing some cases of whooping cough, which, that, as you said, is continuing to be recommended, but that's increasing across the country as well. One of the other things I think that's really, really important, and we take care of a lot of children with cancer, is that vaccines not only protect you, but they protect those around you. Because there are certain conditions or instances where even if you're fully vaccinated, your immune system may not respond well enough or may not be strong enough to actually fight off diseases. So a child who's diagnosed with cancer, as they're being treated, because of the chemo, their immune system is weakened. And so they're more susceptible to these diseases. What vaccinating the majority of people does is it prevents those viruses from circulating in society and circulating in schools. And so when you've got more children that are not vaccinated for these things, it's more likely that these viruses are going to be around. And if there's children in those classes with weakened immune systems from cancer or other things, now we're putting them at risk. And that, to me, is one of the untold sort of stories around vaccines, that vaccines are not just a me situation. This is an us and a we situation, so that we do it to help care for those who may not be as protected because of their immune systems.
We have about 7 more minutes left in our half hour, Doc, and I appreciate your time. So let's just review. So fortunately, the vaccine recommendations are ultimately decided by the states, not the federal government. So this means all of New York, including Western New York, where you are at Golisano Children's Hospital, and the other hospitals in our community are really set by the schedule that the New York State Department of Health and the American Academy of Pediatrics and some of the other organizations are following based on those evidence-based guidelines and not the new guidelines.
Yeah, that's correct. So, although there's a lot of discussion and confusion sort of on the national level, and parents saying what's going to change now, at least here in New York State, the answer is nothing is going to change. We continue to follow the science. We continue to make changes moving forward if the science says that we should. And throughout the years, as I said, many vaccines have been added because science has said, number one, we've developed them, or we found ways to make them more effective, or we changed them. An example of that would be polio. So when I was a kid, I likely got an oral vaccine, a liquid or polio, which was good and protected everybody. But there was some small risk to potentially spreading that because it was sort of a weakened virus, not a completely killed virus. And then they developed the shot, the IPV, which then decreased that risk. And so science showed that that was better than the oral vaccine. And so we shifted to that. So at the end of the day, I think we've got some potential amazing discoveries ahead of us. There's a lot of discussion and research now around a universal flu vaccine that will manage multiple different sorts of variants. And we won't get into this. Is this a good match or not from a flu perspective? The problem is we can create and have evidence that shows that new vaccines are really effective and protect you and are safe. But if people don't have the trust and they don't have the ability to accept those vaccines for whatever reason, it doesn't matter how good they are if people aren't using them. So at the end of the day, I think it's really important. If you have questions, talk to your doctor. If you want to go online and really understand what the science is, go to the American Academy of Pediatrics. They've got great literature and easy to understand narratives around what the vaccines are, why they're recommended, why the timing is what it is, and the latest research associated with them.
And I know Buffalo Healthy Living magazine will have that on their website as well. So we've basically decided, Doc, in this conversation, vaccines continue to remain safe, but how do you set your parents, set parents' minds at ease and also your staff's minds at ease? How do you engage that conversation, not only with the parent, but also your team?
Well, I think there's a couple things. Number one, to sort of look around and see what's actually happening. And so with the decreases in rotavirus and hepatitis B and RSV, which we're seeing in real time, that shows us every single day that these things are actually working. And those viruses that really sort of were gone away from many years ago and now we're coming back like measles, it really proves that when things like measles vaccine rates decrease, and they don't need to decrease that much, just a little bit, suddenly these viruses are going to come back with a vengeance, and they are. So, the history is telling us that they work really well. Science has told us they work really well. And every day, more and more studies are coming out that are proving that vaccines are safe and they are effective.
And we've also seen that several leading medical and public health organizations have filed lawsuits to block some of the overhauls. What do you think the outcome is going to be from those organizations, and even, I understand, unidentified individuals, including the pregnant physician and some others, have weighed in legally? What do you think the outcome will be?
Well, I'm not a lawyer, so it's hard for me to know exactly the nuances of what's going to happen in the courts. At the end of the day, I think it's really important for people to have these healthcare conversations with their doctors, with pediatricians, their family doctors. We're not involved in politics. We don't get paid by these companies to give you the vaccines, which is another thing that I've heard. We're in the business of wellness. In pediatrics, people go into this business because we want to keep kids healthy. We want to put them on the right path to life so that they can live a long, healthy life and reach their full potential. And so in healthcare, generally, you get paid when people are sick more. We don't want that. We want kids to be healthy. And so talk to your doctor if you have questions, talk to your pediatrician, and we'll let the courts sort of decide what they're going to do. But I think New York State has done the right thing. Dr. McDonald, our health commissioner, is a pediatrician. He fully supports vaccines. And he is committed, as is the pediatricians here in Buffalo, to continue to follow the science and make recommendations to families that are based upon scientific evidence.
In our remaining 3 minutes here, Doc, I know that pregnant women are very worried about claims that are being made about Tylenol. And that large study conducted and published in The Lancet confirms that there is no link to neurodevelopmental issues like autism and Tylenol. And in fact, a mom's high fever can cause greater harm to an unborn child than Tylenol. And the same for COVID vaccines. Can you address this concern?
Yeah, I mean, this is another example where we should follow the science. You have The Lancet, which is a very well-respected journal looking at multiple different studies, determining which one of those studies are actually good, solid scientific studies and which one of those are not that great. And what does the evidence show us? And the evidence shows that there is no link between autism or other neurodevelopmental challenges and the use of Tylenol during pregnancy. It's safe. What we tell moms are healthy mom equals healthy baby. So if mom is sick with a virus or an infection and they have a high fever, you want to get that fever down because that could also affect the way that the baby is developing and ultimately affect their brain. So what we tell parents and moms is don't feel guilty. Take the Tylenol if you feel like you need it. But as with any medication, when you're pregnant, always talk to your doctor. Make sure that they know why you're taking it. And if there's some other thing that's happening, we want to make sure your OB can address that to keep moms healthy so we have healthy babies.
It's a brand new year for you, Dr. Turkovich, at Golisano Children's Hospital, and new because Golisano, Mr. Tom Golisano himself, has made a major donation, and we'll also look forward to helping you with the upcoming Variety Kids Telethon, March 21st and 22nd on Channel 2 and WBBZ. What is coming in your mind with the new name change, with the guidelines that he's mandated to make it the best hospital it can be, and what is your mission as we move into this new year?
Well, there's several things. So we are now part of the Golisano Children's Alliance. So there's 12 children's hospitals, and we've started working together to share ideas, share best practices, potentially share resources and specialists. His donation is going to help to support capital needs here and initially help to grow our mental and behavioral health programs and expand them, double the size of them, move them to brand new, beautiful healing space, and start a partial hospitalization program for children who need a little bit more support on the mental and behavioral health side. So, you know, we certainly can talk more about that, but that's one of my passions. I believe in holistic health, not just physical health, but making sure every child has got a healthy body, a healthy mind, a healthy heart, and can grow and be successful in school.
Well, and it's been my honor to help all these years with these telethons to help you and your team. We'll see you on the telethon. And Doc, I want to give everybody the website for Golisano Children's Hospital. It's ochbuffalo.org. So if you want to find out more information about Dr. Turkovich and his team. Dr. Turkovich, thank you for joining us. We really appreciate your time today.
My pleasure. Thank you. We'll see you at the telethon.
You got it. Thanks. Dr. Turkovich from Golisano Children's Hospital of Buffalo. Thanks for watching your Hometown Health Connection on WBBZ-TV. A production fee has been paid to WBBZ-TV by Buffalo Healthy Living and its sponsors.